Okay, it is January 30th, 2025. I have an appointment with my doctors on tomorrow, and this is the first appointment of the new year. Um, we're going to be going over of course, my next surgery is going to be what should have been um, the September surgery last year, which was inserting right side tissue expanders, but they got infected, and so I had to get them out. So now this is to get them reinserted onto the right side of my face again. One on my neck and one on my cheek again. So basically just repeating 2 surgeries ago and hoping for no more infection after that. I will be going over what I'm hoping is the next 1 to 3 years worth of planning for surgeries. Hopefully more like the next 4 years, but in the short term, the next year, to see kind of what we're thinking, what the doctors are really thinking, because while I want to have a time frame to get this done, to get everything done, they can only promise so much of the time frame when complications can happen, surgery schedule, things and everything not being, up to the speed they want, just because things happen and other surgeries have to happen as well. And so I'm just hoping for this all to be done in the next 3 to 4 years. I'm really hoping it doesn't take that long, but with time in between surgeries and being safe about that, and room for complications, fingers crossed there are none, but there's always room for them. So I want to obviously keep that in mind. I know my surgeons are going to think about that too. So that is the plan. And Luna is here to ease my anxiety, of course, as always. Yeah, that's the girl. I love you. Hi, so I am due for an explanation about how the January 31st appointment went with my surgeons to talk about surgery number 26. So my surgery will be on February 25th, so it's coming up. And there were a couple things discussed. Of course, I kind of knew the rundown of the surgery and all that, but there was a little bit of an extra thing, 2 extra things. One extra thing was it was discussed with the hypothermic oxygen therapy doctor, who I saw last year to do the therapy. It was agreed upon him and my surgeons to get me to do pre-surgery oxygen therapy. So that is the plan for that. I will be doing 10 appointments as soon as I can before surgery, and that is to enhance the oxygen coming to my face to help my blood vessels kind of just enhance my blood vessels so that it's ready for surgery and maybe lower the chances of complication. So there's that. Another 2. So there was some discussion about my nose and when they'll start reconstructing. So some people may already be wondering, when are you going to get your nose redone? Well, if you heard about many videos ago, I have discussed that I have to get my nose pretty much completely redone. The issue is because the way it was laid down onto my face initially, when they had skin taken from my forehead, it had scalp hair coming with it. And it's not normal, but it's not unheard of to happen. It just kind of complicates things, but because there were such life-saving surgeries and they had to start somewhere with the nose foundation, that's what happened. So, because there is hair-bearing skin, they are thinking they need to open up my nostrils a bit in order to know what they're working with, know what tissue they can and cannot work with. So, it kind of gives them the game plan on their perspective. So, from my perspective, it's a little bit difficult because it will make me look different more than I already do, which is why I have the increased anxiety that I have, so that will make it worse. The judgment will increase. It will be a wow factor when people look at me. The center of your face is your nose, so if that is, kind of different, it's gonna be noticed, right? So I'm not looking forward to it. However, the hair-bearing skin is obstructing the airway. So while I can breathe through my nose here and there, I wouldn't say consistently necessarily. Especially when allergy season hits, it's even harder, more so. It will help when they open up the nostrils to breathe a little better, I think. And that is one good thing about it. So they're expecting to be able to do that, not this surgery on February 25th, but next surgery when they actually use the tissues, the tissue expander skin to create the flap like they did on this side. So that's the plan. It was a good appointment, but honestly, on that day, which was a Friday, and through the weekend, I had a hard time mentally to have a good headspace. I'm always really trying to be positive, and there, by no means, every day is a positive day. Every day is a good mindset. I mean, I have my days. People not going through this have their days, so I get it. But, sometimes I just really dread this process, but I also know it has to be done. And when it does get done, I will feel better. It just takes time and faith in my doctors and God and support from my doctors, my family, my friends, Luna. It takes a village, and I appreciate all of you around the world supporting me and following me through this journey, because when I say it takes a village, it takes a village. And I don't know what I would do without you guys. So thank you for following along my journey, and especially just expressing to me in some messages that my story has helped them in some way, whether it's big or small. Whether it's they went through kind of the same thing where they were attacked by a dog, but not to the same extent. I mean, it doesn't need to be the same extent to understand how hard it is. It's traumatizing. I mean, cancer to the face is probably traumatizing. You gotta get the same type of reconstruction sometimes. So anything regarding changes to the face or the body, but for my sake, the face, it just, it makes judgment in this world harder. So I know we're all convicted of it, but before we judge somebody, maybe think about what they're going through, and just be gentle and kind, and just be gentle and kind, because I'm sure it's not easy for them, whatever it is, whatever reason you're judging them for a physical difference. Think about why they have a physical difference. Did they ask for it? Probably not. Were they born with it? 50-50. Did something happen? 50-50, you know? Like, just think before you judge. It's one of those things where I hate that it's so easy to judge because our minds just do that. But before you outwardly judge, just think about what your actions do to people. So, with that being said, that is what happened at the appointment, and that is how I feel. Thank you all for following along, like I said, and I will continue to update when I can. Surgery is getting closer and anxiety is increasing, but I got my people, my puppy by my side, and I'm ready. I'm ready for some progress. But thoughts and prayers to protect me from infections and complications would be greatly appreciated. I love you guys. Thank you for watching. See you next time.